Jerusalem, August 22nd, 2025. A grim milestone has been reached. The United Nations has officially declared a famine in Gaza, the first ever recorded in the Middle East. Experts warn that more than 500,000 people are facing catastrophic hunger. Against this backdrop, an Israeli NGO, Physicians for Human Rights Israel, is sounding the alarm, saying the crisis is not an accident, but the direct result of deliberate policy decisions. Karen Shavit, project coordinator at Physicians for Human Rights Israel, puts it bluntly. This famine is the direct result of Israeli policy in Gaza. She argues the situation was inevitable since nothing had been allowed into the territory for such a long time, and when supplies were permitted, they arrived in limited amounts. Insufficient food, restricted medical equipment, and only fragments of the essentials needed for survival. Shavit warns that what the world is now witnessing is only the tip of the iceberg. The famine declaration, she says, signals the beginning of a much deeper crisis, one that could escalate into an even darker humanitarian catastrophe. Her words come at a moment when international agencies, governments, and aid organizations are debating how to bring relief to Gaza and how to deliver it quickly enough to save lives. The declaration itself comes from the UN's Integrated Food Security Phase Classification System, or IPC. This framework, regarded globally as the gold standard for assessing food crises, requires rigorous evidence before a situation can be classified as famine. In Gaza, the data were unmistakable: skyrocketing malnutrition rates, collapsing infrastructure, and rising deaths directly tied to hunger. Shavit also points to accountability. In her words, Israel is in full control of Gaza's airspace, its territorial waters, and its land crossings. There is, she insists, no other authority that can be held responsible for the humanitarian disaster unfolding inside the Strip. For her, the link between control and culpability is direct, leaving little room for denial. When asked about Israel's likely reaction to the UN report, Shavit admits she expected little else but dismissal. Yet she stresses that at this point, the debate is not about whether famine exists in Gaza. It is already here. To deny it, she argues, is to ignore overwhelming evidence and growing human suffering. Her call is for unrestricted, coordinated humanitarian aid. According to Shavit, the only effective response is unlimited deliveries of food, medicine, and essential goods, guided by lists prepared by Palestinian actors on the ground and distributed in coordination with local networks. Anything less, she warns, will fail to meet the scale of need. The UN's famine declaration is not just a technical classification. It is a powerful signal that a crisis long warned about has reached its most extreme stage. In practical terms, famine means that large numbers of people are already dying of hunger or hunger-related disease, and that more deaths are inevitable unless massive assistance arrives. For Gaza's population of 2.3 million, this places nearly 1 in 4 residents in immediate jeopardy. International reaction has been swift. The United States has called for urgent humanitarian corridors. European leaders are demanding that Israel ease restrictions on aid deliveries. The World Food Programme and other UN agencies have said that time is running out and that each day of delay adds to the death toll. Yet geopolitical obstacles remain. Israel insists that restrictions are necessary to prevent Hamas from smuggling weapons or diverting aid, while critics argue that such policies amount to collective punishment outlawed under international law. On the ground, the situation is dire. Bakeries stand shuttered for lack of flour. Hospitals ration fuel, keeping incubators alive for only a few hours a day. Parents struggle to find milk for their children. Aid workers describe neighborhoods where children are visibly wasting away, their thin frames stark evidence of prolonged malnutrition. For NGOs like Physicians for Human Rights Israel, the famine is not only a humanitarian disaster, but a moral reckoning. Their message is stark. If Gaza's civilians cannot be reached with adequate, sustained aid, the world will witness a preventable tragedy of historic proportions. The UN declaration has now placed Gaza's plight firmly on the global stage. The key question is what comes next. Will governments act swiftly to force open supply lines, or will political stalemate continue as hunger spreads? For 500,000 Gazans facing catastrophic conditions, the answer could mean the difference between survival and mass death. As Shavit warns, what has been declared today is only the beginning, the tip of an iceberg of sadness yet to come.
This is the direct result of Israeli policy in Gaza. This situation is inevitable, since nothing has been allowed into the Strip for such a long time. Once it was allowed, it was such a limited amount of both food and medical supplies, right? Medical equipment and all the possible essentials that you could think about. This is only, unfortunately, the tip of this, iceberg of sadness that's expecting us. I think this report came on time to right in the middle of the conversation that we're all having about how to actually help Gaza, how to bring the adequate aid. Israel is in full control of the airspace, of the sea, of the space on the ground, right? It's we all know it, we agree with this, and there is no one else who could be held accountable for the catastrophic situation that's happening right now inside. I didn't expect any other reaction, to be honest, from the Israeli side. But I think at this point, it's not a question if there is a catastrophic famine happening in Gaza. And this is exactly how this should be planned and advocated for. Unlimited aid that's coming for Palestinians by the list that's been given provided by the Palestinian actors, and of course in full coordination with people on the ground.